I'm Dr. Bill Trattler. My practice is called the Center for Excellence in Eye Care, and it's located in Miami, Florida. And we're a big multi-specialty ophthalmology group, and my area of expertise is cornea, cataract, and refractive surgery. We've had our Pentacam for almost 5 years, and it's been a wonderful tool and technology. Originally we had just a placido disc topography unit, which was really wonderful. It does a very nice job for imaging corneas, but once we got the Pentacam, it really allowed us to learn new things about the cornea. It's really helped us a lot. Well, what first interested us about the Pentacam was, believe it or not, a clinical trial. So we were actually forced to get a Pentacam to be involved in the first multi-center corneal collagen cross-linking study in the United States. And so there was some hesitancy at first because I hadn't worked with the technology, and actually it was a wonderful thing that we ended up being in the clinical trial and getting the Pentacam, because I definitely rely on the Pentacam quite a bit. One of the key things is that the Pentacam can image corneas, especially corneas that are a little bit irregular shaped or steeper, where placido disc corneal topographies just cannot image them. And so we found so many patients where this was a tool that we could actually use to evaluate the corneal shape and also follow the shape over time. So it's been a wonderful technology for us to have in our practice. The Pentacam has really improved the quality of care in our cornea practice because it allows me to image patients that I can't always image with a placido disc topography unit. And some of the things that it gives me is it gives me not only the corneal shape, but also the corneal thickness throughout the entire cornea. So I can evaluate not just the central corneal thickness, but also relative thicknesses in other parts of the cornea. That's been very impactful for patients who are scheduled for laser vision correction. I can evaluate patients and make sure that these patients are appropriate candidates for LASIK versus some patients may not be the best patients for surgery. So it's really helped us so much in evaluating patients for both refractive surgery and then also for other technology or treatments like cross-linking. I would definitely recommend the Pentacam to other cornea specialists if they are interested in being involved in the latest and having the latest technology to really help evaluate patients both prior to refractive surgery, as well as for patients that are going to be undergoing technologies like corneal collagen cross-linking. Specifically for corneal collagen cross-linking, which is growing here in the US, even though it's not FDA approved, there's many clinical trials underway. It allows you to image corneas and really evaluate the change in the shape of the cornea over time, both the interior curvature as well as the thickness profiles. And so we've really found it to be so important in understanding how patients have done with cross-linking. So without question, if there's a surgeon who's interested in doing corneal collagen cross-linking or is very active in laser refractive surgery, it's a technology that can be very helpful. I really find that Oculus is a very innovative company. When I first got involved with Oculus, it was just with a Pentacam, and it's a very nice technology. A little different than the technologies that were available at the time. It was definitely a step up from what we had originally, which was the orb scan, which is also a nice technology. But there are definitely some innovations that made this a better technology. And I really just thought of Oculus as the company that made Pentacam and didn't realize all the other offerings that they had. One of the most exciting new offerings that's really going to, I think, be groundbreaking is a technology called Corvus. Corvus is a technology that will measure the strength and stiffness of the cornea and really help us better understand patients that whether they're good candidates for laser refractive surgery, or if we're doing corneal collagen cross-linking, how stiffening the cornea with the technology changes the way the cornea reacts over time. So the Corvus is this technology I think will be really a game-changing technology, and I know I just can't wait to have it.